activities outdoors and maintain some distance. So people certainly have options when it comes to trying to reduce the spread of COVID-19 while exercising.
Right, thank you. And our next question is about the countywide mandate. The supervisors approved a countywide mask mandate to be implemented if certain CDC transmission rate triggers were met. What would have to happen in Monterey County in terms of case rates for you to issue another countywide mask mandate, for instance, a health order?
Okay, thanks, Mia. So through this pandemic, we've been following local indicators to try to inform local decisions and policies to protect public health, and we'll continue to follow those indicators and metrics. We can't predict what's going to happen in the future, so at this point, all I can say is we'll continue to watch metrics such as case rates, test positivity rates, hospital capacity, hospitalization rates, variants of concern when they're identified from the CDC, and also follow vaccination coverage, seeing how we're doing. So we'll continue to monitor and do our best to reduce the spread of COVID-19 and hope for the best.
All right, thank you. Moving on to the next question. One caller into the Board of Supervisors meeting on Tuesday claimed that the county had reached herd immunity. Can you confirm that?
So what herd immunity refers to is a situation in a community where there are enough people that have immunity either through vaccination or through natural infection that when something like COVID is introduced into that community, it's very unlikely that it's going to spread to another person because most people already have immunity. So that's the idea of herd immunity. Researchers are still studying and learning more about immunity when it comes to COVID-19. We do know that the vaccines are very effective in reducing a person's risk for COVID-19 and spreading it to somebody else, but we are still learning about that immune response. For example, we don't know how the immune response may differ necessarily from one person to another. We do know that people who are immune compromised may have no response or decreased response or waning response from their vaccine. So there's still a lot we have yet to learn, and we also know that the variants that emerge may have a different impact on the population that's vaccinated or the population that has natural immunity. So basically, there's a lot of factors that play into whether or not a community has reached herd immunity, and because there's still much that things about this COVID pandemic that we don't know, it would be difficult to say when we would reach herd immunity. What I do want to point out is, though, people who have not been vaccinated should not rely on herd immunity to protect themselves. They shouldn't think that, well, if enough people get vaccinated, I probably won't get exposed because most people won't have COVID-19 because I'm vaccinated. People shouldn't rely on that. People really should take measures to protect themselves and their family by getting vaccinated. And finally, I think it's also important to remember that even if people do want to rely on herd immunity and not get vaccinated, they may want to travel. And even if a person lives in a community which has a high immunization rate, high level of immunity in the community, they may travel to other parts of the U.S. or other parts of the world where that's not the case. And fewer people in the population have immunity, which means that when they travel, they're more likely to come in contact with someone with COVID, and they can come down with COVID themselves. So I really encourage people, strongly discourage people from relying on herd immunity as a reason for not getting vaccinated.
Thank you, Dr. Moreno. Next question. Are you opposed or are opposing a mask mandate at this time?
Well, as a reminder, here in Monterey County, there are face covering mandates in place. So we, in Monterey County, anyone who's unvaccinated is currently mandated to wear a face covering in all indoor settings. And I think that's a very important strategy for preventing the spread of COVID-19. in addition, to that, there's also a current face covering mandate that applies to Monterey County, which is that everyone in certain settings have to wear a face covering regardless of the vaccination status. So everyone's required already to wear a face covering if they're in public transit, schools, childcare, shelters, correctional facilities such as jails, and long-term care facilities. So these current mandates, I think, are helping, adding to the turnaround in this recent surge of COVID-19. We're seeing a decrease in rates. I think the existing mandates are a factor to that. My recommendation has been and continues to be that people wear face coverings in indoor settings, in all indoor settings that are public settings, regardless of face coverings.
Thank you, Dr. Moreno. Moving on to more questions. I've got two questions that I'm going to combine. This is regarding differences in Monterey County health data and the CDC. We've gotten some questions over the last couple of days about the CDC information from Monterey County looking different. I'm hoping you can address that.
What's the question?
The CDC is not showing accurate information from Monterey County, and I think this has to do with CDPH. The county sends its information to CDPH, and then where it goes from there to the CDC.
Yes. Well, what I know about the CDC, yes, Maya. So I guess maybe I'll just comment about the CDC's data. So the data that gets reported to us from healthcare providers, for example, and other entities and other organizations about COVID cases. It comes to us once we receive it. We conduct investigation, contact tracing, but we enter that information in the state portal, and in that state system, that information goes to the state of California. The CDC accesses that information and uses that information to provide data such as case rates and positivity rates for not just Monterey County, for the counties in California, but for other jurisdictions throughout the United States. So as far as the way that we analyze the data, we've been monitoring and reporting out on local indicators for a very long time now during this pandemic, and those are the things that indicators we look at to look for trends. And I think that's really important that people understand. We're really looking not necessarily at day-to-day differences. We're looking at trends to try to help us understand what's happening during this pandemic and how it's impacting our community and our hospitals. The CDC has its methodologies for calculating case rates and positivity rates, which may differ than ours. They may choose a different reporting period. They may choose a different lag time. They may show it immediately, for example, immediate last 7 days, or with a 7-day lag, for example. So the CDC is choosing to report out using their own formulas. So there will be differences between what we report out and what the CDC reports out. And the differences, I don't know that are as important as what I stated before, looking for trends. So I would just suggest that if someone's looking at case rates, they could look at our local indicators and track that over time to look for trends based on local reporting, or they can choose the CDC and look for trends over time. But I think that's really what I would recommend, that people really focus on what are the trends, because that's really telling a little more of the story of this pandemic over time.
All right. I'm just going to quickly follow up. I know we had some media questions on whether the CDC information about Monterey County is accurate, and I think that's what they were wondering. Why does our information look different from the CDC? And it appears there's an accessing problem. And I'm going to follow up with the reporter who asked her this question, because I think Chrissy Mishi has some information that I can provide as well. So moving on to the next question, does the county have the ability to show day-by-day data that is being added due to data dumps, or in our case, cleanup and other weekly reports?
Okay, Mayor. So this may sound familiar, but it's still true. When the health department receives reports of cases, they are reported to us on a daily basis at this point, and includes cases that may have occurred one day prior or a month ago or even longer. But they will come in one day. And when they all come in on that day, we turn around and we post it. And so our community has access to real-time data as it gets reported to us. But that's just the first step in reporting. But we will then do what we've been doing during this pandemic, which is to assign each of those cases to a case investigator. And the case investigator will then make attempts to contact the individual or their family and gather more information, because the reports we get aren't always complete. And so we'll try to get information about the person's symptoms and when they tested positive, if they were asymptomatic, and basically in an effort to determine what day to assign that case to. So even though they showed up on a Thursday morning, or today's Wednesday, show up today on a Wednesday, our case investigators will take the time they need to identify when each of those cases actually occurred. And so that will be assigned to the appropriate date. And so when we post cases, for example, today on Wednesday, we don't know how many of when each of those cases occurred and how long ago they occurred. And the only way we're going to find that out is to really continue to do our case investigation. And then over time, this is part of the improving the data and getting more information in that wasn't reported to us initially, and providing updates to to our website over time to show the cases and case rates over time that have been what the team sometimes calls cleaning up the data, so that it's more reliable and hopefully of use to the public. We do have a chart. We have two charts on our website. We've had these charts up for a while. There's one chart that shows the cases as reported on a daily basis. But we also have on that same website the chart that shows the cases that have been assigned based on their onset of symptoms. And so that's the one that is the smoother curve, because it better reflects the actual cases that occurred over time.
Thanks very much, Dr. Moreno. I've got a lot of questions in early, so I'm going to try to get to as many questions from each of the people who submitted as possible, and then go back and pick up the rest. And next question is also about a mask mandate. After breaking with health officers from the Bay Area and other California counties in not issuing a face covering mandate during the Delta spike, do you believe such a mandate in Monterey County, as cases were rising, would have led to more or fewer COVID-19 cases, hospitalizations, and deaths?
So thank you, May. As I mentioned in an earlier response to an earlier question, face coverings are one part of one strategy among many strategies that we as a community really should follow in order to decrease the spread of COVID-19. So we have face coverings, we have face covering mandates, which are currently in place, that were in place before this surge, this third surge occurred. We have my health officer recommendation for face covering for people regardless of immunization status. We have people distancing. We have who continue to distance, people working from home. We have testing as well. And we also have our team, which assists with organizations that may have outbreaks and trying to further reduce the spread. And so our public health response contributes to the decrease of cases, hospitalizations, and deaths. So the face coverings are one strategy among many that we need to continue to practice here in Monterey County. But the most important strategy really is, and will continue to be, vaccinations. That is the most effective thing that we can do as a community to try to reduce COVID cases, hospitalizations, and deaths.
Thank you, Dr. Moreno. Next question, is the health department tracking how many COVID-19 deaths, hospitalizations, and cases Monterey County has experienced during the Delta spike?
Yeah, so we have that information on our website. We actually, if you go to our website, you can see the number of cases since the beginning of the pandemic and hospitalization, which we update daily. What we know now is at this time that nearly 100% or 100% of cases are due to Delta. So as we continue to report on a daily basis, the case rates, and do the collect more information and clean up the data, all those cases are due to Delta. So as things change, if there's another variant, we'll continue to show the cases and report out on, make available information of which variant is responsible for the cases.
Thank you. Next question, is the health department tracking breakthrough cases? Where can we find that data for Monterey County?
What we do have, Maya, is actually on our website now, we actually have case rates that describe the rate at which individuals who have been vaccinated come down with COVID-19 compared to individuals who have not received the vaccine. So that's really what we are providing to the public, and what we're showing with regards to the rates of COVID-19 among vaccinated and unvaccinated. What it shows is that here in Monterey County, the case rate for people who are unvaccinated is about 35 times higher than the case rate for people who are vaccinated. So that shows that the vaccine continues to provide good coverage for people to prevent COVID-19. We also are showing the not case rates, but hospitalization rates for people who are vaccinated versus people who are unvaccinated. And at this time, the hospitalization rate for people who are unvaccinated, I believe it's about 4.5 times higher than the rate of hospitalization for people who are vaccinated. Again, showing that the vaccines, even with the Delta variant here in Monterey County, the vaccines are providing protection against cases coming down with COVID-19 or being hospitalized with COVID-19.
Thank you. Next question. Does the health department or the county used to provide statistics on cases inside the county jail in a daily report? Is that data available now?
Excuse me, ma'am. I don't have an answer, but I can take that question back to the department, see if we can get an answer to that.
Okay, then I'm going to just throw one more question at you. Can you provide an update on this year's flu season? Is there a similar concern to last year about flu and COVID at the same time?
Thanks, Matt. We're always concerned about influenza. This year is different than last year. Last year, during last year's flu season, we had people spending a lot more time at home and less time out in public, mingling with other people from different households. And as a result, we did see that there was less flu virus spreading last flu season. This season, things may be different. Currently, as we get close to flu season, we do have more people returning to work. We have more people spending time in public settings. And so we again this year have a concern because people are out and about more than they were last year. So with that, I think I strongly encourage people to get vaccinated against influenza. Influenza is going to we may have more cases this year than we had last year, which could pose greater demand on our urgent care and emergency rooms. And so we really want to continue to do what we can to decrease the potential burden on our healthcare system as we have in the past. So again, I strongly encourage people to get the flu vaccine. The flu vaccine has arrived in many pharmacies, and I recommend people take advantage of the time now to get vaccinated.
Right. Thank you, Dr. Moreno. Next question, is the county working to update the COVID-19 dashboard to better represent recent data instead of aggregating data from the past 18 months?
So the data that we have quite a variety of data for this pandemic on our website. And I guess what I'll say is that there are some data that are best represented in aggregate, and some data that is best represented over shorter periods of time. And so we continue to monitor our website, look at what's going on, again, by looking at our indicators and looking at the trends, and then having discussions to see if there are any adjustments that we need to make or new ways of showing data that we haven't showed before. So again, some data is best in the aggregate, some is best shown since the beginning of the pandemic, and some is best shown over short periods of time. So we'll continue to look at that, and I'm sure we've been making updates to the website throughout this pandemic. I'm sure we'll continue to make updates in the future.
Thank you. I'm going to try to squeeze in a couple more questions here. Is the health department tracking COVID-19 deaths, hospitalizations, and cases in Monterey County in school-aged children since the start of the school year?
Thank you, Matt. So we are now showing case rates by age on our website. There's a graph that shows what I would say are age groups by primarily the pediatric population, and then the older at-risk population, and then the remainder of the adults. And so we are now showing case rates, I think it's 0 to 11 years of age. That's one age group. Also 12, I think, to 17 age group, and then 65 and older, and then the rest of the adult population. So 4 age groups. So yes, we are starting to show, we're showing case rates for the pediatric population. The 0 to 11 age group is chosen because that's the population that is not eligible to be vaccinated this time. And the 12 to 17 is a pediatric population that is eligible, which has actually been showing the fastest rate of vaccination in the last few weeks here in Monterey County among age groups. So we do have that. We don't, the hospitalizations and deaths among children are very small. And so our team is is not sharing that information at this time. As we've gone through this pandemic, we've followed state and our own guidance on when and how we can break down information and share publicly. So we'll continue to follow that. If the numbers get to large enough, get to a point that we can share that, and our team believes that we can do that while following state guidance, then we will do that. But at this time, what we can share is the case rates by age group. And I think we have extended it beyond just the beginning of the school year, knowing that beginning of school is just one of many events that have occurred during this pandemic. So we went back several more months so the public can see what the trend has been overall for much of this year with regards to case rates by age.
Thank you, Dr. Moreno. And then what role is the county health department playing in the COVID outbreak at the Monterey County Jail?
Oh, okay. So the Monterey County Public Health has a responsibility to intervene, to investigate and prevent further spread of communicable diseases during an outbreak. And so when we hear about an increase in cases in a particular facility, whether that's a skilled nursing facility, a hospital, or could be, for example, a jail, when we're notified of a potential outbreak, then we contact that agency and we begin to work with them to understand what is happening, what the situation is, and there's a few things that we do. We provide technical assistance on infection control, which could be disinfecting, sterilizing, isolating individuals, cohorting individuals, for example. And then we also can facilitate or assist in making recommendations for testing. What type of testing is required, when to test people, and how to interpret the results. We also facilitate, if appropriate, vaccination. as well as making recommendations or advising on prophylaxis to prevent disease from occurring in someone who's been exposed. And if treatment is available, making recommendations for treatment options depending on the communicable disease that's causing or responsible for the outbreak. So those are some of the things that we've done in the past before COVID. We're currently do that with other organizations that we believe have COVID outbreaks. And we are likewise involved with the jail to provide this assistance.
Thank you, Dr. Moreno. Just two more questions. How is Monterey County preparing to offer COVID-19 booster shots?
I'm sorry, can you repeat the question again?
Sir, how is Monterey County preparing to offer COVID-19 booster shots?
Okay, thank you, Ms. That's a good question. I can't answer on behalf of the county. I can really only answer on behalf of our public health department. So our public health department currently is still providing pop-up clinics and regular vaccine clinics in different parts of Monterey County. And we're vaccinating, I believe it's somewhere between, I think 300 to 500 or 600 people, providing 300 to 500 vaccines a week at these various locations. And we continue to vaccinate several days a week to up to 5 or 6 days a week. So we'll continue to do that. And if and when a recommendation comes out by the FDA, or an approval or authorization by the FDA, and should the ACIP and CDC and Western States Group all support that, then and make that available to Monterey County residents, we will begin to schedule individuals for booster shots at our clinics. And I think as far as the rest of the county, I think maybe you could direct that question to other providers like Untitled Medical Center and our Clinic Services Bureau to see what they're doing.
Thank you. And then just one last question. Do you have any idea when vaccines will be available for children under age 12?
Thank you, ma'am. So I have not, I'm like other public health practitioners are waiting for information from the FDA. So I don't know when that's going to be available, but we will wait and see what the FDA authorizes, when they authorize it, and we will do what we can to encourage all vaccine providers to make that available to that next group of population that has yet to be vaccinated, and try to get as many children vaccinated as possible.
All right. Thank you. Thank you, Dr. Moreno. I think I've used up my half hour with you. Thank you for making yourself available today. And if any other additional questions come through that need to be forwarded, we'll do so. And I do know that there was one remaining question about the jail that we will forward as well.
Thanks.
All right, thank you. So now we're very pleased to have Steve Lisowski, who is a registered nurse at Salinas Valley Memorial Hospital on. He works in the ICU and the COVID-19 ICU, and you may know him because he wrote a really heartfelt editorial and opinion piece that was in the Monterey County, it was in the Monterey Herald. And I really am pleased that he's able to join us today, because really, you know firsthand really what happens to people with COVID-19. And I think that's something it's difficult to share and also difficult to hear.
I completely agree. Thank you so much for having me, Maya. Yeah, I'm amazed at how difficult it has been, especially for families and for loved ones who are watching people suffer. And it was just a situation where I wanted to write something that kind of provided a different perspective. I had seen a lot of posts and a lot of feedback about how COVID-19 wasn't that bad. People recovered pretty easily. And I just wanted to share a different perspective on some of the rather horrific things that myself and my colleagues have seen in the ICU setting.
So let me ask you, from your position as both a registered nurse and a nursing instructor, how do you, we hear about nurses hesitant to be vaccinated as well as regular people to be vaccinated. How do you convince somebody that the vaccine is the right thing?
Oh boy, I wish I had a great answer for that question, because I think that would solve so much of the current pandemic situation that we find ourselves in. I obviously I'm a nurse, so I educate people. I try to understand what the barriers to learning are, or what the barriers are. What are the concerns? Why specifically is someone not wanting to be vaccinated? And then I do my best to provide as much data as I can that shows that vaccines overall are safe, that vaccines really are, as Dr. Moreno mentioned, there are multiple strategies to dealing with the pandemic, and the vaccine is probably the most effective one. And that was certainly true of the original strain of COVID. And we've seen it be true with Delta, although Delta has been more transmissible. So I just do my best to try to understand what the hesitancy is, and provide information in the best possible way I can. In the end, it is the person's decision, but and we certainly are respectful of that. But at the same time, hopefully I'm able to make some kind of headway in terms of, there is unfortunately a lot of misinformation out there about vaccines and their safety and their efficacy. So I do my best to combat some of that and give the person the most educated decision that they can make.
One of the most powerful parts of your opinion piece was what families were experiencing, not just the patient, but what families would experience in the hospital. And I think that was a very eye-opening, because most people don't spend a lot of time in the hospital. They may visit someone occasionally, but this was a really harrowing experience that you were describing that families would go through. And I'm wondering if you could, and you spent a lot of time with it in your piece, but could you give us a kind of a condensed version about, this is what people should expect, and this is what you don't want to expect. You don't want to have this happen to you.
Oh, for sure. Yeah. I mean, I think one part of this whole scenario that is unique is the separation that families are experiencing, because we're in the midst of a pandemic and because we have to have controls to the spread of COVID-19. We're really, we are uncomfortable doing so, but we're forced to separate families from their loved ones. The best contact that they can have with people is literally either through the phone or say through a Zoom meeting like this. So imagine how it would be. And one of the things about COVID-19 too is that the course is kind of lengthy. It's not a quickly progressing disease in some ways. People will languish in say the one of the regular rooms for maybe a week, maybe 2 weeks before they'd even get intubated. And then when they did get intubated, that might be another 2 or 3 weeks. So imagine anywhere between 4 to 6 to 8 weeks of your life having loved ones not be able to contact you beyond the Zoom meetings or the phone calls. Obviously, once you're intubated, you can't talk, you're sedated. So people basically are just looking at the images of you, which of course, for people who have not seen someone in the ICU can be very traumatizing. So I think the whole situation is actually extremely difficult and extremely horrific in many ways. I've seen many family members literally come to a point almost of nervous breakdowns over what they experience when their loved ones have especially a severe case of COVID. And imagine not being able to be with your loved one when they pass, because only recently have we been able to allow people at the bedside for situations when someone is imminent. So it really is a very difficult and horrific thing to be a part of and witness.
And I just want to ask you one more question, then I'll
Sure.
let you go. And I appreciate the long distance Zoom you're giving us today.
Oh, sure.
For people who are hesitant and people who worry about the vaccine, what would you say to assure someone that getting vaccinated is, even if they feel concerned, that it's okay and that it's the right thing to do?
Sure. Yeah, it's certainly challenging, but what I try to remind people of is we deal with science in medicine all day long, and we deal with statistics. All of our medical interventions are based on what we call evidence-based practice. So we do something, we look at the data, we say this works. And then we look at that data and say, okay, this works, but maybe there were some side effects that we didn't expect. And we pay attention to that and we say, okay, are these side effects that we can deal with, or are these side effects that say we shouldn't do this particular intervention or pull this particular medicine? The vaccine is clearly, from the data that we've garnered so far, it's clearly very safe. It's very effective, and it is certainly a much safer alternative to getting COVID-19. Especially the Delta variant, in which we're seeing younger people, younger healthy people get sicker than they were before. So I do my best to just remind people that this isn't as different as people think it is. They get very caught up in the whole mRNA part of the vaccine, and that it's a new vaccine. And the data related to the vaccine has been studied for over 10 to 12 years. Coronavirus is not a new data point that we've been studying. So I do my best to reassure them that this is the best decision that they can make. I do respect their decision, but, and then I try to share personal stories of some of the pain and suffering that I've seen in my hopes that maybe if I make it a little bit more relatable, perhaps they will understand that this is the best course of action.
Thank you very much for joining us. If you could stay on the call for a little while longer, if
Sure.
we have some additional questions for you, that would be terrific.
I'm happy to, Maya. Thank you so much.
Thank you. And now we're very pleased to have Dr. Deneen Gus with our Monterey County Office of Education join us because boy, I'm getting all panicky listening to Steve just talk about that. Parents are experiencing a lot of stress right now with kids going back to school with exposures. And I was hoping you could share some additional information about helping parents find resources and information to cope with this.
Absolutely. Well, thank you so much, Mia, for inviting me to be here today. And I just want to say that I know it's very stressful for parents right now. And I know that there are a lot of parents who are wondering, well, is it safe for me to send my child to school? And I want to start off by saying that, yes, even though the Delta variant is spreading, obviously, in our community, CDPH is letting us know that it is safe to send your student to school because schools are implementing all of the recommended and required health and safety protocols to keep our students and staff safe. And it really turns out that kids are much more likely to get COVID-19 from an adult at home than from attending school. That means that getting vaccinated is one of the best ways parents can protect their children. And I know you have been hearing the message about getting vaccinated and how important that is. And yes, I am getting on that train to talk about the vaccinations and how important they are as well, because being fully vaccinated is the best way to protect yourself and your children and your entire family from COVID-19. And it's the best way, of course, to slow the spread in our communities. Vaccinated people, we do know, can still spread the Delta variant, though much less than people who are unvaccinated, and even less frequently when the safety measures like mask wearing are in place. So this means wearing a mask is still important for everyone to protect themselves and others. I'd also like to recommend parents and community members visit the CDPH Schools Hub parent page, which provides parents with information about school safety measures that protect the health and well-being of students while they're on campus, and the valuable role that in-person learning plays for children's social and emotional development. And give me just a moment here. Well, actually, let me just share with you that that page can be found at https://schools.covid19ca.gov, and you just click on the parent page link. And I think Jessica's putting that in the chat for us right now. We also just want to let you know that when you go to that page, what you're going to find out is that there are 7 safety layers to keep kids safe while at school. And you heard Dr. Moreno say earlier that it's really about layered mitigation strategies. So I want to talk a little bit about these strategies for just a moment. First of all, I already mentioned the importance of being vaccinated, and I've already mentioned the importance of wearing masks, especially when you're indoors. But the other things to think about are ventilation. Good airflow in classrooms and school buildings helps remove air that may contain the virus, and it replaces it with healthy air for your child. And all of the schools are aware of the importance of this good ventilation. Also, hand washing. Washing your hands regularly reduces the amount of germs on your hands to prevent the spread of COVID-19 from touching services and others. And I also just want to mention that the schools are being so diligent about regular cleaning, regular sanitizing. Our school facilities are the cleanest they've ever been before. The next item is just the importance of staying home when sick. So if your child wakes up and they say that they're feeling sick, please keep them home from school so that they can get better faster. And of course, ask the school if your child needs to be COVID-19 tested before they come back to school. I also want to point out that for those parents who need to stay home and because your child's sick, and you might experience a loss of income while you're home with your sick child, you can visit the safeatwork.ca.gov website, and you'll find some resources that will be very, very helpful to you. And I'm going to ask Jessica if she could also just put that website in the chat for us as well. And then I want to talk a little bit about testing. COVID-19 testing can detect the virus even before your child or other students or teachers start to feel sick. Schools that do regular testing with unvaccinated students and teachers help everyone stay safe and stay in school. So if your school does not have a testing program in place, please visit MontereyCountyVaccines.com and their testing resource page, which lists the testing locations that are available throughout the county. And that information is available in both English and Spanish. And I just want to also point out that the testing is not invasive at all. It is so easy and it's absolutely free. So parents, if you have any concern about letting your child participate in COVID testing, please talk with your school officials. I think that you'll find it's not intrusive at all. And it gives you that peace of mind because you know whether or not your child does have COVID. Also, contact tracing. Your child's school and the local health department will notify parents and teachers who have had a close contact with someone on campus who tested positive for COVID-19. They are keeping everyone safe and they are here to help. So I want to also just reinforce, if you are contacted and told that your student had a close contact with a positive case, you do have options for quarantine. And so I want to talk a little bit about the quarantine, but I also just want to say, please, if the school calls you or the health department calls you, remain calm. It's going to be okay. We are in the middle of a global pandemic, and so there are going to be exposures. But there's no reason to panic. There's lots of support and lots of resources available for parents. So now let me talk a little bit more about those 2 options for quarantine. First of all, there's a modified quarantine. Modified quarantine allows students to stay in school for in-person instruction. And I want to point out, though, that modified quarantine does not allow students to participate in extracurricular activities. It's only in-person instruction. And that's, of course, if they remain asymptomatic. And of course, they would have to participate in regular COVID testing. So COVID testing would need to happen at least 2 times a week during that modified quarantine period. And schools will help families navigate this process. So it's not like the parents have to remember everything I'm saying right now. When they get that phone call from the school or from the health department, all of this information will be shared with them. And then, of course, there's also the standard or traditional quarantine. Traditional quarantine is when a student remains at home for the required period of time. And of course, students will be encouraged to test and monitor for any COVID-19 symptoms they might experience. And if your child is in traditional quarantine, they may be able to participate in short-term independent study, or at the very least receive packets of schoolwork that they can work on while they're in quarantine. So this is not the same as distance learning. I want to make that very clear. Distance learning is no longer allowed by the state, but schools will provide information about the learning options when they notify the families that their child has been exposed. Most of the schools in Monterey County do offer short-term independent study, but not all of the schools have that up and running at this time. You have to remember this was a very quick turnaround for schools, so they're still working on getting those various options set up and ready for the parents. Let's see, what else might I want to cover? Well,
You know, I've got a question that came in that it kind of follows up on what you were just talking about. I'm going to throw this at you. So catch. You mentioned that the testing for students is non-intrusive. Is testing done by nasal swab, or is it another type of test that is done?
good question. So there's various ways that the students can be tested. Most of the schools are participating in the state's testing task force program, and that program does give both rapid antigen tests to the students and PCR tests, and those are nasal swab. Other schools have other testing programs that they're utilizing, but for the most part, it's usually the nasal swab. Some may be a saliva test. It depends on what program the school's using.
Thank you. And then I have a question that came in about student behavior, and I'm not sure really what it means. So I'm going to ask the person who submitted that if they could send in a clarifying question, if they could clarify that question. And then Dr. Gus, I'm going to take that question after our next presenter and circle back to you if that's okay. Thanks very much.
Yes.
For the great information.
Well,
go ahead.
And if you'd like, Mia, I might be able to answer that question.
Does it make sense to you? It didn't to me.
So yeah, they're talking about some alarming incidents involving student behavior across schools in Monterey County. Well, you have to remember that students have been out of their classrooms for a very long time. And so we are going through that process of reacquainting our students with the classroom expectations, with school rules. It's that whole retraining of our young people. We are seeing students who are coming back and they're struggling with some social and emotional issues. And that's why there's been a major focus on ensuring that the needs of our students are met. And we do have support available on the campuses, whether it's school counselors or therapists that are being provided availability to the students. And the therapists, some schools partner with Monterey County Behavioral Health. Other schools have their own therapists available. But yes, we are seeing students who have experienced a lot of trauma during the pandemic. Some of our students have lost family members, friends, and they are really, some are struggling to get back to normal, or at least our new normal. And with that, it's really, creating a time where our teachers and our school officials are working extra hard to make sure, again, that they're reviewing school rules, reviewing expectations, reaching out to students and families and making sure that their social and emotional needs are being met, and any mental health issues that they might be experiencing, that those needs are met as well. So I hope I answered that question.
I think you did, and thank you for intuiting it better than I did. So we want to get to our last presenter because last but not least, September is Preparedness Month. And in Monterey County, we understand the need to be prepared, but it's always good to be reminded about why it's so important. And we have our friends from the Office of Emergency Services here to give us those important reminders, because if it isn't fires, it's flood or earthquake or something else to make our year just a little more interesting. So we've got Kelsey Scanlon and Luna Muhammad from the Office of Emergency Services to share some really good information.
Hi, thank you so much, Maya. So Monterey County Office of Emergency Services is really responsible for a variety of things, but primarily coordinating with our first responder partners to any type of incident. And I don't need to tell anybody here just how chaotic 2020 and 2021 has been. But what we saw over the past year was both the River, Carmel, and Dolan fires, as well as obviously a global health crisis, and then winter storms on the burn scars, all three of which resulted in either a shelter in place or an evacuation warning or order. And so I think this is actually like oddly a perfect example of all the different ways in which it's important to be prepared. With the River and Carmel and Dolan fires, those were really what's considered a no-notice event, meaning that there wasn't a lot of time to be prepared to leave. Obviously, the River fire more so than the Carmel or Dolan fires, but even those were a bit more protracted, only by maybe an hour or so. And then we saw the 2021 winter storm debris flows and mud flows, which had a significant more time just due to the predictability of the event and the known atmospheric river coming into town, which obviously gave residents about 48 to 24 hours to prepare to leave. And then with COVID, obviously we had a shelter in place for over a year. And that's a different type of hazard to prepare for. And so one of the things that Luna is going to do is show you where you can find resources on how to prepare yourself, your family, your business, your place of work, your kids, and what it is that you need to do for each of them and how best you can not just prepare yourself, but how to change the culture within your household and your workspace to be a bit more resilient as we move into the next decade.
Thank you so much for that, Kelsey. I'm going to go ahead and share my screen. And can everyone see that? Okay, it should say Ready Monterey County.
Yep.
Cool. So this is our Office of Emergency Services webpage to help our community prepare for disasters. If you go onto this webpage and you scroll down, you can see there's an emergency preparedness toolkit that's available in English and Spanish, and another toolkit available with additional information for people who have animals or businesses, children, or any additional needs such as access and functional needs. We will be adding a response and recovery toolkit within the next couple months in English and Spanish as well, but I'm going to just share with you real quick that toolkit. And so if you click right there, you can scroll down, and on that fourth page of this packet, there are 12 tasks you can take to become more disaster resilient, to be better prepared to manage any type of disaster that comes your way. Now, every disaster is going to require a little bit of a different response and different preparedness, but there's overarching things you can do that can protect you for everything from a pandemic through an earthquake and everything in between. So get the knowledge. You don't need any money to do this. Learning your risk, you can go to my hazards, and all of the links are available throughout this packet along with a fillable plan. Learning your rights during disasters, signing up for Alert Monterey County so that you can be notified if we can give notice. We did give notice in all of the disasters we've experienced, and information through Alert Monterey County. It's a great resource for emergency information and learning how to respond and recover from disasters. Duck and hold on and cover your head and neck during an earthquake, right? Avoid floodwaters, never walk or drive through 6 inches or more of floodwater are some examples of how you respond to different disasters. For the pandemic, masks and vaccines, social distancing, and those extra hygiene precautions are really important. The next step is getting resources, making an evacuation kit, a household kit for when you do have to shelter in place, storing important documents, and making sure your properties are properly insured. And then kind of leading on to some of that culture of preparedness that Kelsey mentioned, getting ready, just knowing your neighbors, joining a local CERT team or the Red Cross or some other volunteer organization within your community, making your emergency plan and practicing and practicing and practicing. We have Shakeout coming out in October. That's a great opportunity to practice the plan that you make, and then practicing resilient habits. keeping your phone fully charged, your gas tank at least halfway full. A lot of those things, some of them do cost money, some take time, most of them don't take that much time or that much money, and can be done. You can do at least one of these today within 5 to 10 minutes. So please do try to take those steps. And again, it is Preparedness Month. It's a great time to try to check off some of the boxes on this list. I know it can get overwhelming. Don't worry about doing everything at once. Just take it one step at a time. If you can get something done, it's better than nothing. And knowing how to prepare, taking those steps, it can not just save your life, but it can make a disaster experience a lot less impactful and harmful to you. Thank you. Please let me know if you have any questions. I'm adding the link to that webpage into the chat right now.
Thank you so much, Luna. So that wraps up our presentations. We still have Steve Lisowski and Dr. Gus, and of course, Luna from OES on. I do have one question for Dr. Gus. There you are. I see your name. This is a question regarding testing. I'm hoping you're still listening. I'm not hearing you. Dr. Gus, are you still on the call? You know, I am not, she's not responding and her mic is muted, so it's possible she stepped away. So I'm gonna send that question to her unless I see her appear shortly. Are there any other questions for any of our presenters, for OES on preparedness or Steve and hospital COVID-19 experiences? Seeing none, that will wrap up our briefing for today, and I'll forward this last question to MCOE. Thanks everyone for joining and thanks for participating. Our next media briefing is next week. We'll see you then.